Hi, I'm Jane Morton, and this is section 3 of our videos about how Medicare works with Indian Health Service. As I mentioned in sections 1 and 2, very few people with Indian Health Service are interested in what we're going to talk about in this. But if you get a lot of your services outside of Indian Health, you may be interested in what we're talking about in section 3. We are Western Montana Area 6 Agency on Aging. Our office is here in Polson, but we serve Lake, Lincoln, Mineral, and Sanders counties and the Flathead Reservation. When you have Part A and B and your prescription coverage, Part D, if you have Indian Health Service, it will cover any co-pays or deductibles that you have. However, if you want to be fully covered when you go outside of Indian Health Service for care, you may be interested in a Medicare supplement plan or a Medicare Advantage plan, and so that's what we're going to talk about now. A Medigap plan covers all the deductibles or co-pays for original Medicare. For instance, under Part B, where you're responsible for 20%, if you have a Medigap plan, it will pay that 20%. Under Part A, for instance, if you are hospitalized, under Part A and Indian Health won't pay that $1,400 deductible, you can get a Medigap plan to cover that, depending on what Medigap plan you choose. There are 10 different plans to choose from, and how much they cost depends on what you want, what level of coverage you want, and what type of coverage you want. Generally speaking, it's going to start out at about $100 a month. Then it's going to go up as you get older. This chart shows the different Medigap plans and what they cover. Part A coinsurance is if you're hospitalized for a long period of time, longer than 60 days, and you have a co-pay that you have to pay, any Medigap plan will cover that. Hospice is mostly covered at 100%, but there may be some small co-pays under hospice. Any Medigap plan will cover that. Under both Part A and Part B, if you're not in Indian Health Service, you're responsible for the first 3 pints of blood. Any Medigap plan will cover that. Preventive care coinsurance, there is hardly any, which most preventive care is covered at 100%, but any Medigap plan will cover that. Part B coinsurance, most of us have most of our expenses under Part B. That's doctors, labs, all medically necessary stuff that's not inpatient basically is covered under Part B. Part B pays 80%. If you go outside of Indian Health, you pay 20%. Any Medigap plan will pay that 20%. If you have a minimum 3-day hospital stay and you have to have skilled nursing care, Part A will pay all of it up to 20 days. If you have to be there longer than 20 days and you have co-pays, Plan A or Plan B won't help you with that, but these other plans that are shown will. Part A deductible, is that $1,400 if you're hospitalized and Indian Health is not going to cover that $1,400. A Plan A Medigap will not help you with that deductible, but other Medigap plans will. This actually is an out-of-date chart. There aren't any plans anymore that will cover the Part B deductible, but it's only $198 annually. Part B excess charges, if you choose to go someplace that doesn't accept Medicare assignment, for example, the Mayo Clinic, they haven't signed an agreement to accept what Medicare allows for what they charge. So by law, they can charge 15% higher than what Medicare allows, but Medicare won't pay any of that extra 15%. Just these Medigap plans will pay excess charges. Medicare doesn't pay outside the United States. But if you have a foreign travel emergency, there are some plans that will cover your foreign travel emergency. Again, I believe this is a little bit out of date because I believe they cover a foreign travel emergency at 100% now. Out-of-pocket yearly limit only applies to the plans that only cover a portion of your share. And if you have had to spend this much, then they will cover at 100% for the rest of that year. The Medigap premiums vary based on how old you are and the amount of coverage you want to pay for. The Plan A that covers just the basic things is the cheapest. And Plan G that covers everything is the Cadillac, the most expensive. Also, some plans tie their premium cost to your age when you initially enrolled. They're called issue age plans. They tend to be higher at the beginning, but not increase very fast because your premium cost is always tied to that age you were when you first bought it. Some plans are structured to automatically go up as your age increases. So that premium cost is tied to your attained age, in other words, whatever age you are now. These plans tend to be cheaper in the beginning, but they increase pretty steeply as you age. Deductibles and copay amounts, that just depends on which plan you choose, which level of coverage that you choose. Again, ballpark number would be about $100 a month. There's an important consumer protection under the Medigap plans, and that is the guaranteed issue period of 6 months after you start Part B. For 6 months after you start Part B, if you want to buy a Medigap plan, they have to sell it to you for the same thing they would sell it to anybody. They can't ask any medical questions. It doesn't matter if you have some really expensive medical conditions. If you want to get one during that 6 months, they have to sell it to you. Then once you have it, you can keep it as long as you want to, as long as you keep paying the monthly premium. So that open enrollment period, that guaranteed issuance for 6 months can be very important if you have serious medical conditions. Outside of that 6 months, if it's even 1 day outside of that 6 months, they will give you a medical questionnaire. They can require a physical. They can turn you down. So that 6 month guaranteed issuance can be pretty important. Again, who pays first? Medicare is primary to your Medigap insurance. So if you go outside of Indian Health, Medicare pays, then your Medigap plan pays. If you have Indian Health, Medicare pays the bulk of it, and then Indian Health pays what's left. If you have employer-sponsored insurance, usually your employer insurance will pay first and Medicare is secondary. Okay, Medigap plan supplements original Medicare. So if you stay on A and B, when you go to the doctor, you give them your Medicare card and you give them your Medigap card. Or there is another alternative way to get Medicare, and that is to buy a Medicare Advantage plan. If you go this route, you're still on Medicare, so you still have to pay that Part B premium. It's just that your bills don't go to Medicare. Medicare sends your Advantage plan, your insurance company, a chunk of money for your benefits, and then they are the ones that decide what co-pays you have. They have their own co-pay structure. So it's better than just having A and B, but not quite as much coverage as having a Medigap policy. So if you're going to go the Medicare Advantage route, you pay your monthly Medicare premium to Social Security, or to Medicare, and then you also pay your monthly premium for your Medicare Advantage plan. Your Medicare Advantage plan includes your drug coverage, so you don't have to get a separate Part D plan. It's included in whatever premium you're paying to your Medicare Advantage plan. And then your Medicare Advantage plan has their own structure of what co-pays you have, and they also have a maximum out-of-pocket. In other words, after you reach a certain amount that you've had to spend, then they'll pay everything 100% after that, and there are no co-pays. This just shows it in a different way in writing, that it combines parts A and B and your prescription coverage in a private insurance policy. You still pay your Part B premium. Your health coverage is equivalent to having original Medicare, but they structure it differently, and they may have co-pays that you have to pay. If you go with Medicare Advantage, you're not allowed to buy a Medigap plan. In other words, you don't cherry pick from this side and this side. You either go with this way or this way. Again, they have a structured copay system. They may have deductibles that you have to pay. Most of the plans only have deductibles if you have really expensive meds. Medicare Advantage plans may have additional benefits like vision, dental, and hearing. They're limited benefits. Usually they're limited to yearly checkups and cleanings. There are some Medicare Part C plans without a monthly premium, and if you have Indian Health Service for your prescriptions, you may want to look at that. There are PPO plans and HMO plans. PPO plans will pay in their network or out of their network. They pay in their network better. Most of the out-of-network costs, you pay 50%, they pay 50%. There is an HMO plan that only pays within their network. If you go outside of their network, it all comes out of your pocket. They're adding preventive services every year, it seems like. The newest things are screening and counseling for depression, alcohol misuse, cardiovascular disease, obesity, and more. Also, the donut hole has been a really difficult thing for people with really expensive meds. They have reached a point in the year where they had to pay really expensive prices for their drugs. However, the donut hole is almost non-existent at this time. Medicare will not contact you by phone for any reason. So if someone calls and asks for your Medicare number, just like your Social Security number or your banking information, don't give them any information. The Senior Medicare Patrol is a part of Medicare that helps people with problems with their bills or reporting fraud or Medicare abuse. If you call our office, we can help you or refer your case on up at the state level if we need more help. In 2018 and 2019, they changed the Medicare number so that it doesn't have your Social Security on it anymore, but you still need to protect your Medicare number because fraudsters can still use that to try and get money out of Medicare. One thing you need to know is there's never a charge for Medicare. Medicare will not call for information. If you lose your card or damage your card, we can order you a new one, but there's no charge for that. Also, there are no plastic cards. One scammer thing is they call and say, well, we can get you a permanent plastic Medicare card if you just pay such and such and give us your Medicare number. So then they have done two things. They've stolen some money directly from you, and they've also stolen your Medicare number so they can steal money from the Medicare pot. So Medicare will never call you. If someone calls claiming to be from Medicare, it's a fraud, just like those calls where they claim to be from Social Security. Just hang up on them. This is what your Medicare card looks like. You need to protect it and not share it with anybody else, not let anybody else use it for care, and don't give those numbers to anybody, even if they say, oh, you can get this free, whatever, if you only give us your Medicare number. That's all a fraud to steal money from Medicare. I'm a SHIP counselor. We have 4 SHIP counselors here in the Polson office that are trained and certified by the state of Montana to help you with Medicare. You can reach our office by calling the state toll-free number or the toll-free number that just goes directly to our office, or our local phone number. We also have SHIP counselors living in Lincoln, Mineral, and Sanders counties. If you call our office, we can put you in touch with those people. Here are the numbers for the Missoula and Kalispell Social Security offices. If you have questions, you can also call them. They'll probably tell you to call us, but you can call them. If you want to look online for other information, here are some good websites. Or if you're interested in the Big Sky RX program and you have more questions, there's their phone number. And that's the end.